Okay, it looks like we're recording. Dr. Morse, if you want to begin?
All right, hello everyone. We have a lot of new information to go over today with the new orders and some new information shared from MDHHS. So we'll get right to it. So you probably heard or saw that there's a new epidemic order that will replace the current one. This one will come out early Saturday morning and will be in effect until the end of the month. You can find them on the state website. I have the link here, so that'll come out to you when these go out later today or later this week. There's an FAQ in the same place it's been all along. There's also a fact sheet that does have some information about athletics on it, and those are all in the same area as the epidemic orders are at. So I went through and found every area where there was a change in the wording, and the ones that impact schools, excuse me, I have included here.
What do they want for this one? 3,000. How much? Three?
Can everybody make sure that their phones or computers are muted?
Decent car for $3,000. So we'll see that. Yeah.
So there was just one change in point number 5. The activities not allowed include those that involve physical contact or where masks cannot be worn. Previously, that also included activities with a high degree of exhalation or physical exertion indoors. So that's where they're now saying things like basketball practice, where you're allowing dribbling or shooting drills, but not scrimmaging could be allowed, so no contact, but they could practice indoors, or allowing people to use the weight room as long as the stations are 6 feet apart. Those kinds of things are now being allowed. In terms of the face mask requirements, they did add in a statement about group fitness classes and exercise activities to the face mask requirements, and that it must meet the requirements in their interim guidance for athletics. And they changed one of the exemptions on face mask requirements. There's been an exemption in there that if you're giving a speech for broadcast or for an audience, you did not need to wear a mask if you were 6 feet away at least. They have changed that now. If you remove your mask to speak to an audience, you have to be at least 12 feet away. There are additional changes in some wording in the order, but these are the only ones that really affect the school. So the day after we talked last week, the state also released a guidelines for operating school safety. So that is also on their website. And that's really aimed more at the schools that have not been open at all to in-person school this year. It's meant as kind of an update to the Safe School Roadmap that came out in the summer. So it's not really a huge change. It's just kind of an update. So they also have a second document that goes over the rationale for this document, and they do have references at the end of this document. So I'm just going to go through it really quickly, just some highlights that are in it. These are all direct copy and pastes from this document. Some copy and pastes are kind of paraphrased, meaning I didn't put the full sentence in there, but it's all direct language from this document. So they're strongly encouraging all schools to do in-person learning as much as possible, especially for young kids and those that have difficulty learning. You should try to shoot for half the time in person, recognizing you might need to close if you have an outbreak or if you have too much staff in quarantine that you need to go to remote education. They specifically state that unless you are told to close by an order, school reopening and closing decisions will ultimately be made by local school districts. So this is putting in writing that ultimately it is your decision if you want to be in person or not, unless you are directly ordered to do differently. The other thing it specifically states is that the prior guidance that was based on the reopening phases, so on what phases the state was in based on counts and cases or local case rates, is now obsolete. So the metrics, the case counts, the percentiles, those guidances are obsolete now. So in its place, decisions to stay open or remain open are basically going to occur, if you're able to follow infection control, and you're going to use a holistic assessment of several different metrics. So basically what they're saying is what we've discussed in the past, where you consider numerous different things about whether or not you should stay open, rather than just looking at, what's your cases per million, what's your percent positivity, if you're above X level, you need to close. So that is officially over. And now they're officially agreeing with what we've been doing, which is just looking at the overall picture and making decisions from that. They talk about testing for COVID in schools. So they actually are rolling out a voluntary program where you can, if you decide to, and again, this is more targeted towards those larger schools that have not been open at all yet, can decide to do asymptomatic testing of your teachers to kind of monitor for illness. It is not required. It will never be required. I would be shocked if they ever did that. I can't imagine that. They had a webinar this morning about this. It was recorded, so it should be on the state website. At some point they may offer this as an option to test students. That's a little more tricky. But again, this is just something that's an option that the state is offering. They talked about vaccinations, about how staff and teachers are frontline essential workers. And, we're working to get those individuals vaccinated. They talked about federal funding being available to help cover the cost of mitigation strategies. The document talked about safety protocols, pretty much everything that you guys already know about and you guys have been doing all along. Talked about face masks, and they did talk about not just cloth masks, but also surgical and KN95 masks, which are essentially like N95 masks. Are just from other countries, so they're not as in demand by our medical staff. And these are things you can purchase using that federal money. So because we're not in such a shortage for PPE, those are things you could consider purchasing for your staff to help protect them a little bit more. Further discussed in the safety protocols, they talk about hand hygiene again. They talk about spacing and movement. They say that, you need to maintain 6 feet of distancing at all times. If you can't physically do that, that you should consider doing kind of a hybrid schedule where you have, half kids there on Monday, Wednesday, half the kids there Tuesday, Thursday. And then they say that if you can't do that, yet you decide you want to proceed with in-person learning regardless, that at a minimum you should keep kids 3 feet apart. So I already have gotten a question about this, taking this to mean that we're being allowed to have kids 3 feet apart, right? No, that's not what this is saying. This is saying that if you can't space people 6 feet apart and you choose to proceed with in-person schooling despite not following this guidance, at a minimum, at least keep them 3 feet apart. So this is not giving you permission to go 3 feet apart. There is a good discussion about ventilation in there. I did not put it all down. It's pretty duplicative to what you've read before, but it does have links in there to grant money to help you improve your ventilation, similar to what you've been given before. They talk about symptom screening, and they specifically say that you should have students and staff screen at home prior to coming to school, keeping sick people home. The one issue I have with this is one of the recommendations actually goes exactly contradictory to a CDC guideline. They say that symptomatic individuals, and the link goes to the symptoms for COVID, may not attend school until they have tested negative with a PCR test, or they have completely recovered according to CDC guidelines. And this link goes to the definition of recovery from isolation for COVID. So the recommendations for students actually is that you should be able to test by PCR or a rapid antigen test if you are symptomatic, not just PCR. So I'm really confused as to why that's there. I just haven't had a chance to really ask anybody about that. And if they are negative and they've not been exposed to anyone with COVID, then they should stay home until whatever symptoms they have improved according to guidelines. So if, fever free for 24 hours, if it was nausea or vomiting, if those things have improved for 24 hours, that kind of thing. So there actually is an algorithm now on the CDC website in the school screening section that says, okay, did they have close contact with someone with COVID? If they did not, are they going to a school with moderate rates of transmission, which all of our areas do? So yes. Did they test positive or negative? If they had a negative test, then you stay home until your symptoms have improved according to existing school policy. So that would be in accordance to our communicable disease handbook. If they tested positive or didn't get tested, then you stay home for the full isolation period. I added this footnote here because you have to, read through different pages on the CDC, but a COVID test is a COVID-19 viral test, which includes either a PCR test or a rapid antigen test. So I am giving you permission to follow the CDC guidelines on this one. Again, I'm a little bit confused as to why this was worded such, and I do plan to follow up when I have a chance. So in the guidance, the further things they covered, just things that you already know. They talked about dealing with positive tests. They talked about handling food service, athletics, and extracurricular activities. Different from the roadmap with athletics, they just said that you should consult the current orders. They talked about cleaning surfaces. They talked about dealing with water after prolonged shutoffs. For the workplace safety precautions, they referred you to the October 14th emergency rules and to CDC guidelines for further resources. They talked about quarantine and isolation precautions and referred you to references for that. And they encouraged using schools for childcare and after school programming as needed, and then referred you to rules for using, referred you to the rules for childcare operation. So that is what is in that document. So again, it's just basically an update to the roadmap that came out over the summer. It's nothing terribly earth-shattering. Again, I think the big things are, it officially says that you guys are the decision makers in whether or not you're in person. Obviously, we're definitely going to help you make those decisions, but it's ultimately your decision. We don't use case counts anymore. It's a multifactorial decision in terms of whether or not schools stay open. So those were a couple of important things in there. And again, just that discussion about, when a symptomatic kid can come back to school is not as cut and dry. It's not as strict as what they state. Going on to vaccine scheduling, we are working extremely hard on this. I'm sure you've heard. If not, I just want to let you know that we do not get the amount of vaccine that we order each week. We are not able to vaccinate anywhere near a big portion of the number of people we need to vaccinate each week. So we are working as hard as we can to get through who we need to vaccinate and to schedule clinics. This is same information I went over last week, but if you are in the 6 counties for Central Michigan District Health Department and no one has contacted you yet, you can go to our website. And if you are the school, you can click on the critical or essential business to sign up. If you are an individual working there, or if you want to have your individuals sign up for vaccination, then they can go to the worker tab and sign up, and then we will contact you to get things scheduled as we can. You can also sign up through an opt-in email system, and so we can keep you notified of things as we schedule more clinics. For Mid-Michigan District Health Department, similar, there's a form on our vaccine page. It states if you are a critical business, fill out this form, so you can do that if you are a school. There are links for Sign Up Genius to schedule appointments, but many of those are already booked, so you can keep checking if you are an individual. And again, you can also sign up for our newsletter to keep notified on upcoming clinics. For District 10, all of their clinics are booked at this time. You can keep watching the website for additional clinics to be scheduled, and wait to hear from them in terms of scheduling school clinics. And you can also sign up for their public health alerts if you are not getting them.
Hey, Dr. Morris.
Yeah.
This is Kevin. Hey, and I can speak a little bit more to District 10 just so everyone kind of understands. We are expecting that hopefully by the end of this month, January, we are going to start to receive additional vaccines. So our plan is hopefully that we are going to be able to get to our schools in February. So just so that's the timeline we're looking at. Yeah.
So it's just been very unpredictable as to who gets what vaccine and how much, and it's difficult. And again, we just really ask for your patience and understanding, and there's really not anything we can do about it. So I know I've been bringing this up each week just so that if any of you want to jump on, you can, but we will be putting out a press release. I'm thinking probably more towards February at this point, because again, at this point we have too much interest in vaccination, and so I hesitate to put out a press release encouraging people to get vaccinated, and we already have people that really want to get vaccinated and we have to tell them they have to wait. So I'm thinking probably more towards February, but I will get that written up within the next couple of weeks. And we will get that out to any of the schools that have wanted to sign on to that as a supporter, so that you can make sure you agree with the statement and have a chance to make any edits or suggestions before we do anything with that. So in the meantime, I just will say, if you are having school clinics, if you're having any issues with low uptake, if you find only half of your employees are willing to get vaccinated, if they have any questions or concerns about vaccination, don't hesitate to send me an email with those questions. I'm happy to address them. If you need to have or want to have a webinar meeting to go over the vaccine so they can ask those questions directly, whatever it is to help. We've been hearing that in a lot of businesses and schools, so far the percentage of uptake has been pretty good, but whatever we need to do to help, just let us know. So the report that we usually have each week was not done as of this morning. So I think everyone, including our EPI director, is just insanely swamped right now with vaccination efforts. So I kind of hobbled together some data from other sites. So this is Michigan over the last 3 months. This is our testing rates. So a little dip over the holidays, but we're right back up. This red one is our new cases, and it's our rates per million people. So we had that post-holiday blip, but it seems like we're dropping down. The dotted line is the United States. So again, just compared to the United States as a whole, we're definitely going in a better direction. Current hospitalizations, again, we continue to drop down on average, and the US unfortunately keeps going up. And then new deaths, again, are dropping, fortunately. And again, the US is there. This is a slide actually that was shared in the press conference yesterday. I thought it was really interesting. Michigan is the blue line. You can see here that we popped up over Ohio, and then really, tightened up on our restrictions and have dropped well below our neighboring states. So, and this is rates of cases, not total cases. So we want to compare apples to apples here. So I just thought it was a nice image. I know people get really frustrated with our restrictions, but just to show how well we're doing, and we want to make sure that this trend continues to go down before we start really opening things up. These are the daily case rates over the last week, the rate of cases. I know Misaki seems to be an outlier here. It's a very low population county. They had on average about 10 cases a day. And so their rate seems quite high, but we're not too dark in our area here. I did find a nice site with some interesting hospital data. I'll just show you here. I thought this was an easier way to visualize it. So looking at this is Saginaw here, it's Saginaw. But our area hospitals, you can see like Gratiot, 25% of their beds are occupied by COVID patients, which is 15 people. And so I'm not going to go on all of these, but just to see the size of these dots here, it gives you a good idea that we're not doing too poorly in our area in terms of hospital utilization. Our bigger reference hospitals have more, but that's to be expected. I'm going to click over here and switch over to ICU beds. And this looks a bit darker, but they have, they don't have a very big ICU, but they have half of their ICUs occupied by COVID patients, which is 4 beds. So I just thought this was a little bit different way to look at it, and I thought a little more meaningful way to look at it as well. Because otherwise it's just a bunch of numbers. This is our lab turnaround time. The hospital labs are still right around 2 days at the most in terms of turnaround. The commercial labs are about 3.5 days. And those are the ones that have to get mailed to like Mayo or usually out of the state. So that's still quite a good turnaround time. For our data, things have gotten a little bit worse. Again, this is a rolling 7-day average, so that little blip over the holiday is catching up. So the state average cases per million are up a little bit. And I'm not going to go through all of this, but we will send it out. And this is all from the My Start map. So it's all pretty easy for you to find if you're interested. So we're still nowhere near what we were before the holidays, though. So, and I think that is all I have for today. So we can open it up to questions.
Hi, can you hear me? This is Brett Zuver from Grant Public Schools and District Health Department 10. Hey, quick question. I know if I heard you correctly, said that it may be February before Newaygo County or our area has the opportunity to even schedule our shots. Is that right?
Yes.
Okay. And I guess I'm just looking for a little advice on how to talk to our staff about that when they've got friends that have, school systems have already had, anybody who wants a shot has already had their first round of vaccinations and scheduled their second round. That puts us in a tough spot. And I know it's not your fault or your choice or your call or anything like that, but boy, that's a tough thing for a lot of our school districts here. And we've been in a situation where we've had to hit pause a handful of times because we've had so many staff members having to quarantine and have had some people sick, and it's a tough thing. So I just didn't know what your thoughts on that were, is the best way to explain that to our constituencies here.
Kevin, do you want to take that?
Sure, I can. When we're talking about vaccine limits, this is what we're talking about. Next week, I'm expecting that I'm going to get 975 doses of vaccine for our 10 county health department. That's a little less than 100 doses per county. I can't start a large group like the schools with 100 doses per county and then hope that I'm going to get another 100 the following week to be able to get everybody in, let alone try to move through the rest of that group, where you got the 65 plus population that are pounding on our doors saying we don't care about them. We think that with our schools, we need to be assured that we're going to get at least 2 allotments of the 975, and then we can begin looking at trying to set up clinics for the schools, because we'll have vaccine where we can start them and get them finished versus having to do half of this school this week, come back the following week and finish that school up. It'll take us forever to get our schools done if we have to go that way.
Okay, and I guess I'm well aware of many school districts who've had their staff members have already had their first round. So are they running they have a different philosophy or different protocols than District 10?
It may be just they're getting more vaccine. It may be that their hospital systems are getting vaccine that they're using, and that's where they're choosing to go through and do. I can't say. I mean, I know, I had heard, that doesn't matter. I can't really speak for the other areas. I can only speak for within our jurisdiction.
Okay, thanks.
This is Marcus in MidMichigan. I'll just support what Kevin is saying. In our jurisdiction, there was a hospital that finished their 1As, and so they picked up a couple schools, and which was great for them to do that. We were so happy, but we can't do any more schools, so it creates that inequality. We're really glad that hospital did that, but they were out and they couldn't do the rest of them. So the problem really is the supply. And it necessarily creates that unevenness in the distribution when you just don't have enough vaccine for everybody.
Okay. Well, I will read through the questions that are typed in, and then at the end, we will get to other questions that may not have been typed in. So one of the questions is, would the face mask exemption allow faculty to teach at the front of the room without a mask if they could maintain 12 feet social distancing? So there's always been an exemption that said you did not have to wear a mask for a speech for broadcasting or to an audience, provided the audience is at least, it was 6 feet away, now it's 12 feet away. There's also the rule that whenever you're in a school, you have to wear a mask. So my feeling is that you need to wear a mask when you're in the school. So that, I mean, that's something you can ask the state, but mask is better than no mask at all times. I was just trying to point out the differences. I don't know if that does apply to the schools or not. Again, you can ask the state, but I would find all the reasons you can wear a mask rather than not. So the next question was about the same thing. So are you then supportive of allowing students to return earlier than 10 days, provided they have a negative test? So I'm assuming that has to do with quarantine. Well, sooner than 10 days if they have a negative test. Should the test be after so many days? So, and you can clarify if I'm off base. What I was talking about was someone who had not been exposed to anyone with COVID, had symptoms, and then tested negative. So, okay, so I think that's you. No.
Hi, Dr. Morse. It's Justin Glusing from
Yeah.
Crawford Novel. I'm the one who asked the question.
Yeah.
My thinking was for an individual that is displaying a principal symptom but has not been exposed to someone with COVID, should they be tested so many days after symptom onset, or can they be tested immediately and if it's negative, return? And they're better, you know, the symptoms have subsided.
Yep. So if they get tested and they're negative and they've not been exposed and they're fever-free for 24 hours, or they've not had diarrhea for 24 hours or whatever it is, they can come back. It doesn't have to be a certain number of days. The number of days issues comes in if someone's been exposed, like if they're tested too early, it has a higher risk of false negativity. That's a whole nother topic, but yeah, it doesn't necessarily matter what day they're tested. Okay, we're talking about, so I'm going to kind of skip some of the vaccine questions, but the next one was for District 10 and about where will the vaccine clinics be? And so that is, I think, probably a discussion for later and will be had between the schools and the health department. When scheduling staff for vaccinations, would it be helpful to know how many vaccines are per vial? We'll schedule all that and take care of it, so don't worry about that. Since the date we surveyed staff asking who would like vaccine, we've had staff who initially declined now wanting, so basically it sounds like at District 10, there may be more people at the schools who want to get vaccinated than in the initial survey. So just for those who are from District 10 on the call, you might have to survey the schools again before you make plans. Can you speak about winter sports and antigen testing? Do we need to antigen test to practice? Is there a cost? So there is a pilot program going on with a few sports that are in their playoffs. So we will not talk about that. You know who you are if you're in that program. So right now, to do other sports, There is no testing required. However, there can be no contact and you must be 6 feet apart. There is a testing program that is done by college athletes to do contact sports, but it's more than just testing. It's also being in quarantine for 2 weeks before competitions. It's much more aggressive, and that is why really high schools have never been able to do that. So at this point, you don't have to test, you just can't have any contact or be within 6 feet of each other.
Hi, Dr. Morse. This is Mark Platt from Hart. I'm the one that wrote that question. And the reason I'm asking is I'm trying to figure out what in the world to do with winter sports, because with the recent pause, I think we're going to have some teams choose to travel out of state and play, which then becomes a Michigan High School Athletic Association problem for us. But I've heard that testing might be a part of the winter sports program. And I just wasn't sure if you could shed any light on that. I know it's not right now, but do you see that as something we're going to have to do, after February 1?
I don't know. They've said all along to us that the pilot program wasn't necessarily a stepping stone to more testing for the sports. It was more to see how feasible it was to test in the schools, to then expand it to testing the teachers. I would encourage you to communicate with the state. I know a lot of times things do get confused between MDHHS and the High School Athletic Association. So I try to communicate more with MDHHS about what their plans are. If you have concerns about athletics occurring that are not strictly allowed, or about people doing things that are not the safest, I would encourage you to talk to MDHHS about that. And if you need contacts, we can find those for you. But I did specifically ask the state after this order came out to clarify, and they said that the testing option isn't just a testing option at this point. It's a very rigorous quarantining, and only the athletes only stay with the athletes. It's basically for people that live on a campus and can just stay with themselves and not with friends or family ever. So I have no idea what will happen after February 1st. And we're never told what's going to happen until a half hour beforehand. So that's the best I can tell you.
No, thank you. That a lot of that matches what MASA said yesterday. I'm just trying to get a handle on whether or not winter sports will even happen. But I appreciate the answer. Thank you.
A teacher has a medical exemption to wearing a mask. She has a COVID positive student in the classroom. Students wear masks, teacher does not. Teacher was not within 6 feet for 15 minutes or more. Does the teacher need to quarantine because she does not wear a mask? That's a little hard to answer without all the information, but if you feel that the teacher had a significant exposure, so even if she was not, or he was not, even if she was not within 6 feet for 15 minutes, if she was in that room for 3 days breathing the same air, of a contagious person, it might consider a contact. We don't really take masks in consideration for anybody when we're considering a close contact. So you really should treat a non-masked and a masked person the same when making determinations. So if we need to speak offline, we can, or you can speak with your communicable disease nurse in your county to help you make that decision. Any additional thoughts related to quarantine after out of country travel? So again, if they go to a high risk country, they need to quarantine for a minimum of 7 days and get tested on day 5. If they don't get tested, they need to quarantine for 10 days. So I think that's something, unless it changes between now and then, I think that's something that you could very easily start communicating with your families. The list of those countries are on the CDC website. We've gone over it before. It's pretty much every country, really. So again, that is something that you can discuss. In terms of in-country travel, that is something that, is up to your discretion. The other thing is then also just, how are you going to know? Are you going to take word of mouth? Are you going to, just go off the honor system? So, that we kind of leave to you. But again, you may want to start communicating that now as people start making those plans. If a teacher or staff member is vaccinated and then is deemed a close contact, do they still need to quarantine? Yes. So everything is the same with vaccinations. You still wear a mask, you still have to be quarantined, you still have to be isolated. So everything is exactly the same at this time. As we get more and more people vaccinated and as we know more and more about how the vaccine works in the real world, hopefully some of that's going to go away. But for now, everything is the same. How long before the vaccine becomes effective? There is some minimal effectiveness, probably a week or 2 after the first dose, but really don't count on it. 1 to 2 weeks after the second dose, it is typically fully effective. But again, we still do everything we can to prevent infection that we've been doing in the past. I know you need to continue with quarantine if exposed after the first dose. Will people still? Yes. So we just went over that. So we still do everything the same. Hopefully not forever though, right? If someone is considered a close contact, if they get tested and it comes back negative, do they still need to quarantine? Yes, they do, because the test could be false negative, especially early on in their exposure. I think that was the last question that was typed in. If you have a question and you want to unmute yourself and ask it, feel free, or if you want to type anything else in, feel free as well.
Dr. Morris, this is Jennifer Buriger from the Mount Pleasant Public Schools. And on behalf of Isabella County and our district, I just really wanted to thank you and the folks at the Central Michigan District Health Department. I think you're doing an amazing job, and I can't even, I'm getting choked up even thinking about everything that you've done for us today with the vaccines. And I know it's hard. And I know it's hard that they're not all readily available as much as we'd like, but we are just so very, very grateful for you and your staff. Thank you.
I will pass that on. I know they'll appreciate hearing that. And I guess I have a question. I know, it was mentioned the survey of staff interest. Are you finding that you have good staff interest, or is it lower than you expected? Is there anything we can do to help with that?
For Mount Pleasant specifically, our staff is ready to go. So I have 450 staff members total, and I had about 332 that said they wanted the vaccine. So we're all in.
Good.
interest is high in Wexford, Manistee, ISD.
So I'm seeing numbers between 25 to 50 to 65%. And then one said 2/3. So, you know, we'd like to see it more towards 80, 90%. So, so as you're doing surveys, you know, if you have if not interested, why? Or you know, if there's anything we can do to help answer questions, feel free to let us know, because 50 to 60% is pretty low, but understandable given that this is new, and you know, there is hesitancy for sure. There was one additional question that came in. What is the latest guidance on neck gaiters? So the state of Michigan in their Mask Up campaign has officially said that they do not recommend neck gaiters. The CDC says as long as they're double layer that they're acceptable. My opinion, and you know, anyone else from the health department on the call can jump in, but my opinion is if you can just have them double layer it, so just fold it over and make it a double layer, it's acceptable. I feel like we have had such a long climb to get people to wear face coverings and masks to begin with. You know, if they're willing to wear that, it's a win. And if we can get them to just fold over the top once and have a double layer, then, you know, it's not worth the argument about, well, now you need to wear this kind of mask instead. So I just would rather have them wear that than nothing at all or have an argument about it. But again, just as an FYI, you know, the CDC and MDHHS do have a disagreement on that one. And I don't know, that was specifically from MMDHD. So I don't know, Marcus, if you have a thought on that. I don't want to speak for the whole organization.
No, thanks, Dr. Morse. I agree.
Okay. We do have some other questions. Do you foresee a restriction on those employees who choose not to get vaccinated? No, I wouldn't foresee that. Please let us know how we can advocate to get vaccines for school employees. Yeah. So we are working as hard as possible to do everything we can to get more and more vaccines. Any other questions? All right.
Hello, I have one question.
Yeah.
Yesterday in a meeting that we had, the question came up, can employers require employees to have the vaccine?
So yes, they can. The one thing, and I'm not giving official legal advice, and it's something you'd want to discuss with your legal counsel and everything, but it's just something to keep in mind that this is still considered an experimental drug. It is not officially approved. And so I know there have been employers who that has given them pause in terms of requiring it, because again, it is still considered an experimental drug. But yes, employers can require it.
Okay, thank you.
Mm-hmm. All right. Well, we will talk again next Thursday. And if you have any questions or concerns in the meantime, you know how to find us.